Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. Today on the Healthcare CEO Show, I'm joined by Joe Walker, president of Larry H. Miller Senior Health. Under his leadership, the organization has rapidly expanded its home health and hospice services, now operating across 12 states, while launching new initiatives in assisted living and senior care. We're going to explore how Joe and his team are building continuity of care, scaling with intention, and delivering on the promises made to the baby boomer generation, all while navigating the complexities of talent, technology, and capital in a shifting healthcare landscape. Joe, thanks for joining us on the show today.
Daniel, great to be with you today. Thanks for having me.
Now, for those listeners that are outside of the Utah area and are maybe a little unfamiliar with the Larry H. Miller name, can you tell us a little bit about that?
Absolutely, yeah. Larry H. Miller is a well-known name throughout the Intermountain West. For a number of years, they owned the Utah Jazz of the NBA. They were the second largest privately held auto dealer with auto dealerships throughout the Intermountain West and getting out into California and Washington, Oregon. And then over the last several years, they've kind of pivoted as a family and made a decision to refocus their efforts. They sold the Jazz. They bought our healthcare company. About a year after buying us, they sold their auto dealerships, and they've pivoted to 3 new platforms where they're focused on senior health, sports entertainment. They own the Salt Lake Bees. They just purchased Real Salt Lake of Major League Soccer, and then they have a chain of movie theaters that are run through that platform. And then Larry H. Miller Real Estate that does master plan communities, multifamily housing, construction, big projects throughout Utah. So it's a mission-driven organization, a family office. Their stated purpose is to enrich lives, and I think you can see in the way that they've moved their investment focus is really targeted to find ways to do exactly that.
Yeah. Why of all industries, senior health? I mean, it's you're already gonna have some competition there. You're entering a market that, already exists, and but the impact you make can be great as well.
Well, and not just senior health, but you think about the courage and conviction it takes. They closed on our deal on December 31st of 2020, at the height of the pandemic, before we had a vaccine, when our patient population was on the very front lines of the pandemic, with a lot of open questions about the viability of this industry and the extent to which this industry could survive a pandemic that seemed to be perfectly targeted at our patients, right? Yeah. And so for them to step in with a sizable investment at that point and really put their money where their mouth is and say, we believe in this, we believe in the opportunity, even at what we hope was the lowest moment for our industry, they stepped in at that point. It's remarkable and something that I'm continually impressed by, even today, 5 years out.
Yeah. Now, over the last 5 years, I assume you've seen lots of change. What are some of those big changes that have occurred over the last 5 years?
Within our industry or within our company?
I would say within the company itself. Yeah.
Yeah. So as we came into the Larry H. Miller Company, we were primarily focused on our short-term transitional SNF model.
Okay.
And home health and hospice to deal with the patients coming out of our buildings.
Yeah.
And as we got in and started to grow and started to discuss with the family and the board and the leadership here at this company, the opportunities to build a more fulsome senior health continuum, we got a lot of excitement and a lot of conviction around the idea that the future belonged to operators who could come to the table with a large segment of the post-acute continuum under their control. Yeah. And we started to pilot that and build that in a few markets and started to have discussions with patients and payers and other providers about what that could mean for them, and found a lot of excitement and acceptance and found that it really did work. It lowered costs. It provided a much better patient experience, a much better clinical outcome, and was giving patients a feeling like they had more control and understanding of what was happening to them as they moved through the post-acute experience. And so as we started to get that feedback and really see it, we got a lot of excitement and then built a plan around expanding and taking that idea to every market we're in and then additional markets beyond that to build a post-acute care continuum for senior patients.
That's right. And it's a typically segmented aspect of, like you said, acute care. What does continuum of care look like today?
Yeah, for us, if you think about patients who come into this post-acute continuum, a lot of times we get patients that are starting a transition in their healthcare journey. So a lot of times you got mom and dad who've been living at home for 40, 50, 60 years. But because of some declines, things start to happen, and maybe they have a fall, they have a stroke, something that takes them to the hospital, and then they get the information, hey, before you go home, we probably need to have some additional care. So they'll come to one of our short-term buildings. Maybe as we're there and as we work with them, additional deficits are discovered, or we determine, working with the family as we care plan for this patient, that additional services are going to be needed once they get home. Maybe even it's a decision that home is no longer the correct location for this patient, but we often find ourselves at the center of these transition points for patients. There are a number of care settings that can take care of these patients and do it well. In the past, one group would operate the SNF, another group would operate the home health, another group would operate the assisted living or the independent living. And so the patients would kind of have to deal separately with each of those groups and figure out what was best. And instead, what we can do is, as we sit there and have those conversations with the patients, we have business lines available to them that they understand, okay, I've enjoyed the care I've had here in the SNF. I know I'll get similar care with the home health and hospice, or with the assisted living, or with the long-term care skilled nursing. I think it's like, Marriott or these other companies that have cross-branded across a spectrum to say, you can trust our product. We build a brand that you recognize, and so you're not just kind of making decisions out of whole cloth, but you have an experience and a basis for understanding why you're choosing the provider you're choosing as you move to the next phase of your care.
Now let's talk a little bit about market expansion. At this point, you're spread out across how many states? 11, is that correct?
Today we're in 12 states we're
12 states.
operating. We've got projects ongoing that will quickly bring us to 14 states.
Okay. Now, as you look to scale outside of a market where, the brand name is truly recognized, what are potentially some of those challenges?
Healthcare is such a challenging space, right? It's tough to go and distinguish yourself among providers.
Yeah.
We have an incredible team. Our operations team is the best in the industry. And their ability to go into a market and to sit down with the stakeholders, whether that's hospital presidents or healthcare system leaders, or even patients, their advocates, physicians, and sitting down with them and helping them understand the value and care proposition that we present. That's kind of level one, is go in and give people the message in the hopes that they give us the opportunity. But then ultimately, Daniel, everything we try and do here in our corporate office, it rises and falls on the backs of our healthcare workers. So once we get those opportunities, it opens the door to those relationships. It ultimately comes down to the nurses and the CNAs and the therapists and the clinical leaders within our buildings and agencies who actually fulfill the promises that we've made in all these meetings. And as they do that, and as our partners within a market start to see lower length of stay, lower cost of episode, lower readmissions, much higher patient satisfaction, then it becomes kind of a snowball that just grows and builds on itself. And soon we have patients requesting our buildings and our services as they come into the continuum, because they understand, they've heard from other people what the experience has been.
Now, when you're thinking about your long-term expansion plans, is it expansion through all new de novo locations, potentially some acquisitions along the way, or a blend of each?
I think so. Yeah, very much. It's a challenging time for all healthcare, because the cost of construction have gotten so high, and so much of the healthcare system, our reimbursement is not under our control. So when you couple government legislative designated reimbursement with rising costs of labor and rising costs of construction, new projects are few and far between. We're able to do some, and we have some underway, but we also are identifying opportunities where we can acquire buildings for lower than the cost of construction that lets us expand into those markets. Also opportunities to lease existing buildings. If we have operators who are maybe ready to transition out of the space or maybe try a new approach to patient care in a given market, then I think we're a good partner to come in and lease those and re-engage in those relationships as well.
Now, let's talk about the baby boomer generation, because obviously it's
Yeah.
a large generation, and every day there's more and more people being added or retiring, I should say, right?
Right.
So, as that generation ages and requires more and more care, um, what does that, is there a gap between what's currently available and what will be needed?
Yeah, it's the most important question of our industry right now. And I think you have a number of dynamics that are all coming together at the same time. Today, we've got 11,000 new people turning 65 every day, adding to this senior care Medicare market. On top of that, we have this, I think, really exciting extending lifespan for people. Harvard scientists say the first person to live to 150 is already alive today. And so we're thinking about this expanding senior population. We're thinking about expanding not just lifespan, but health span. Because there's not a lot of good to getting additional 60 years of your life if that's just kind of sitting in a care setting, never moving, never being able to interact. So we've got to think about expanding health span. Those dynamics are meeting up against this rising cost of construction, rising cost of labor, decreasing healthcare workers, less nurses in the field than we've ever had before, lower admissions happening in nursing schools every year. 60% of healthcare workers say they don't plan to be in the healthcare space within the next 2 years. It's a crisis.
Yeah.
And we've this baby boomer generation has transformed the economy at every stage of their lives. And a lot of private capital has been waiting for them to then come to what is probably the last stage of the economy that they're going to have this kind of impact on. And so a lot of dollars have been put in to prepare for this demographic opportunity, but we still don't have the capacity that we need. And if you look at what SNF and ALF bed demands are projected to be 5 years from now, and what capacity is today, we were behind before the pandemic, and then everything paused, and nothing got built for 3 years. And now we're in a world where it's really hard to make a construction project pencil. And so we have this need that is coming, and no one can stop it, but we have a capacity that is just not ready to care for it.
Yeah,
it's really concerning, I think.
I would have to agree with you, and it's been mentioned, on the show previously as well. How are you all dealing with the caregiver shortage? I mean, it's a national problem. Like you mentioned, there's fewer admissions to schools. There was a high burnout rate, through the pandemic. So you had people retiring earlier than maybe they would have.
That's right.
Yeah. So, I mean, what are maybe some of the things that you guys are working on that would help to maybe retain, talent longer?
Well, I think, Daniel, that's step one, right? I think for us, it's a multi-pronged approach. One, we have to find ways to retain the people that we already have, and finding ways to build their shifts and what they're doing at work in a manner that's sustainable, helping them continue to feel that pride that healthcare workers felt during those 3 years of the pandemic, when they'd end their shifts to people standing outside their apartments and applauding them for their work that day, right? We have to continue to help them feel the meaning of what they do and the importance of their role. We have to give them opportunities to grow and develop within their career, and give them environments that they can stand to be in and day out. And so there's very much an internal focus there. We have to continue to kind of grow the bench of leadership and people who are committed to this industry. For us, internally, that means having a team of people that are dedicated to attracting, retaining, and developing leaders within our company, so that we have great leaders leading today, and we are building leaders for what we want to do tomorrow. So as we expand and opportunities increase, we have a bench of leaders that are steeped in our culture and in how we care for patients, ready to go. Beyond that, we have to build resources outside of what's already there. For us, we're involved in a company called Proxima here in Utah, that they're doing something really interesting where they're going to segments of the population where ordinarily healthcare workers don't come from, particularly disadvantaged populations, and showing them the pathway of a healthcare career where it's CNA, nurse, therapist, doctor, healthcare administrator, and bringing them in and then wrapping them. There's a lot of public services out there that pay for rent and childcare and food and education, but sometimes these people don't know how to access that. So giving these people this vision of a healthcare career, wrapping them with the services that are already there. So often the people who start this path, it's one flat tire. It's one missed grocery bill. It's one babysitter calling in sick, and it derails an entire career. Yeah. So helping them do that to build up a workforce that ordinarily we wouldn't have. And then we also have started an international solution where about 3 years ago, we started recruiting and bringing nurses over from the Philippines, from Africa, from other countries. Immigration is a really, really tough issue right now. Yeah. I truly believe we will not solve this healthcare crisis without a common sense immigration solution. I hope we don't have to get to crisis point before we can all agree that there's a need to have a common sense approach and get the workers here who want to do the work and who can take care of our patients.
Yeah, I mean, at the end of the day, it's just a numbers thing, right? There's just not enough. Correct. And you need more, and you have got to get them from somewhere, right?
And they're out there, they're there, and they're great.
Right. And it presents new opportunities for other individuals that can then, feed into a growing economy at that point. When you think about how the expansion will evolve over the next, handful of years, let's talk a little bit about challenges and opportunities. Let's start with challenges. What are some of those challenges as you look to further expand your market presence?
Certainly. The costs we talked about, having the right leaders. We've learned over and over through expansion that the right leader is literally a game changer. And with the right person, we can come out with great success, establish that reputation the way that we want to. Without the right leader, we dig ourselves a hole that can take years to climb out of. So the right person, I think, is really important. The other challenge we face, and I think our entire industry faces it, is there's a lot of negative press, a lot of negative discussion about what senior care is, which is not to say that there aren't companies that have dropped the ball and have not done the right thing for patients. That certainly happened. But I think overcoming some of the stigmas that our industry has and helping people understand the mission of what senior healthcare could be and the need, right? It's interesting to work with people. Everybody has that first time they have to consider putting their parent into an assisted living or a skilled nursing facility, and educating them on what it should be and what it could be, and really how these are things that should be enhancements to the lives of the people we love, not a place where we shudder them away. And that's what we try and build. And I think there's a challenge to educate the country about really what the entire senior care space is intending to do.
Yeah, you mentioned the stigma around the industry as a whole, and I definitely think it's there with your assisted living locations, right? And there are definitely some innovative ways that people are looking at long-term care, not just like here's like this place where you're going to be for the final stage of your life, but like how do you flourish in this stage as opposed to it just being like the last stage per se.
That's right. And let me, in our assisted living, we started that. Assisted living often is the first step into institution or congregational living. And often, once you start down that path, you continue down that path and progress through the different care settings.
Yeah.
When we bought our assisted living and took it over, we put about a couple $1 million of capital into it, brought it up to our standard. We took out an 8-seat movie theater and put in a gym and brought our therapeutic approach to it. And over the 18 months that it's been operating, we've sent 9 patients back home. 9 patients have come in, and after receiving several months of care in our building, someone who thought, I'm done living at home, was able to go back home. That is 100% the right thing for patients, and it is a terrible business model.
Yeah.
Because we struggle to keep census up.
Right.
But there are ways to take that setting and say to people, this doesn't have to be the end. Like we can have a setting that you come to and let's put in some effort, let's give you some care, and let's see where you go.
Yeah.
But people are being very innovative about the ways we approach senior care. You've seen all kinds of stuff out there that I think is really exciting. But we've got to get some energy, some focus, and some funding behind these ideas that are working.
What are some of the ideas that you have in the pipeline, if you're willing to share, that you're really excited about? Some of those innovative type things.
We've got a number of things, and I'm happy to share.
Yeah.
And here's why, Daniel. We are more passionate about solving the problem than we are about being the solution.
Okay.
And no one company is going to be the solution here, right? When you think about senior care, there's like 13,000 skilled nursing facilities across the country. Right. The single largest owner has 400. So not a consolidated industry, right? And all of us kind of have to find the things that work. I really, really believe in this idea of a continuum. Yeah. And I think you're seeing some of the bigger players in our industry who previously spun out these assets and siloed them off in separate companies are now doing the work to try and bring them back together so that they can present a coordinated front of care to the different players in the market. And I think you'll continue to see it move in that way. We're looking at different ways to do memory care, different ways to integrate technology. We've ordered some robots here for our corporate office to play with, and to program and say, okay, can I get it to distribute water around the office like a CNA would around a building? Right. Can we get it to passively scan vitals? Can we get it to interact with people that could provide companionship? And trying to see where are the ways where technology can start to complement what our caregivers are doing. And we never look at technology, whether it's AI or robotics or EHRs or any of it, as something that will allow us to take people off the floor. I don't think that's ever the answer. But the more we can allow our people to spend their time with patients, the more technology can push them to that. I do think that's where we could see rapid improvement. And so we're exploring AI charting. We're exploring how much of our entire documentation can be done either offshore or through AI so that our nurses are free to spend their time with patients. A lot of things.
How do you think that there's potential challenges with all of the new technology? I mean, there's a lot of new technology rolling out. You've got to roll it out across, many markets. You think the outcome will outweigh the risk?
Absolutely, we're going to get there. I'm very bullish on technology revolutionizing healthcare. We're going to get there. Yeah. If you just look at the vaccine, right? The fact that for the first time we had an mRNA vaccine that we were able to use instead of dead virus. I mean, the pandemic happened in February. We had the vaccine by May. Approvals took another 9 months, but technologically we had an effective vaccine 60 days after, right? Yeah. Technology is absolutely going to take us there, and I firmly believe that. The challenges are, our industry is always going to be a late adopter because it's tough to find additional margin to make those investments to explore. Yeah. The other challenge is when you have 13,000 nursing homes with such disparate ownership and operators, interoperability becomes a huge issue. Whether we're talking EMRs or whether we're talking different kinds of therapy tech, the ability for information about patients to move through different systems and between different providers in a way that's seamless and where things don't fall through the cracks and where different technologies understand prior patient experience and now can be applied here, that's going to be a real challenge. Personal opinion, when we passed the Obamacare and mandated EMRs, we should have mandated some standards so that everybody's records would be done in a way that they can talk to each other. Something that when you talk about continuums that we really focus on is having technology across our continuum that works with one another. So that technology experience becomes seamless as you move from care setting to care setting. But we're going to have to figure out how to do that across a much broader setting. But we will. I believe we will.
This is a big question, lumping it all together. You're looking at Larry H. Miller in the future. What is the number one challenge and what is the number one opportunity?
Number one challenge. The number one challenge, I think for us, is staying disciplined. There's so much opportunity out there, and there's so many problems that need to be fixed. And I think staying disciplined and focusing on the things that we can be the very best at. That right now, I think, is our challenge. And letting others do the things that they can be the very best at.
Yeah.
But then finding a way to work together. Because we have to have this team approach if we're going to take care of these patients the right way.
Agreed.
So for us and our team, I think staying focused on the things that the industry needs from us as a market leader and letting others take the lead where they can, I think that's maybe our biggest challenge. For us, our biggest opportunity, I think we are uniquely positioned as a company in that we have billions of dollars behind us.
Well capitalized helps.
Well capitalized. But Daniel, what we have is we have patient mission driven capital behind us.
Right.
And that's one of the things that our industry is really grappling with right now. When you have quarterly returns that you need to deliver for your shareholders, or when you have a PE firm with a 4, 5, 6x expectation every 3 or 4 years, it's really, really hard to balance the needs of the patients and the needs of your employees with the needs of ownership.
Yeah.
So to have the kind of capital partner that we have, but who is focused on enriching lives. Yeah. And I can tell you over the last 5 years, every time I've gone to the Miller family, to the Miller company leadership, and talked to them about investments we needed to make because it was the right thing for our patients, or it was the right thing for our employees. It may compress the margin. It may delay some return timelines. Every time they've taken that, and the very first question I get from Gail Miller every time I meet with her is, how are our patients doing?
Wow.
And I think to really be successful in this industry and to deliver on the promise we've made to patients, you have to have that patient mission-driven capital behind you. So our biggest opportunity is to be the one to lead out in that way and to go deliver for patients everywhere we can, a premium experience focused on patient outcomes with that patient mission-driven capital behind us. I think it's a unique opportunity that we have, and I'm hoping that other family offices and other large capital providers out there who can see the benefit of that mission will jump in and join the fight in a big way, because I think that's what we really need if we're going to deliver on the promises we've made.
That is that's inspiring. You're not building for the exit, you're building for the impact. And that is
absolutely
such a greater purpose. Absolutely love that. We wrap every show with the final 2 questions.
Okay.
First question I have is this. There's a saying that leaders are readers, and everybody pretty much has a favorite book or 2. Is there a book that you've read that has inspired you along the way that you'd want to share?
I love to read. I spend a lot of time every day, and so it's hard to narrow it down. I really, really love Good to Great by Jim Collins. Those are principles that we live by as a company, and that we try to build. And I love Atomic Habits. I think, personally, that was one that I really took to heart, and I think has transformed how I approach my life, really.
Yeah, too. Atomic Habits is one of my all-time favorite books. I absolutely love it. And I'll go back and reread it as well. Yeah, great book. Yeah. Final question. This is really where I sort of turn the mic over to you. We've got an audience of listeners that are in similar position to yourself, healthcare executives who are dealing with some of the same challenges and trying to overcome some of those daunting challenges, but also looking at some of the same opportunities as well. What advice would you give to that person that's listening to this show today?
I think for all of us in healthcare, it's really important to begin with the end in mind. We do a lot of cool stuff. We do a lot of hard things. We do a lot of challenging things. And it's easy to get lost in the trying to balance budgets, trying to find margin, trying to protect your market share. Like, those things are important and time consuming. And that's why we get paid to do what we do. But begin with the end in mind. The privilege of being in healthcare for me is healthcare is where we're all human. We spend a lot of time in our society trying to draw distinctions between people. And when you come in to get treated, that's where like humans are humans and those distinctions melt away. And it's such a privilege to be there where we really get to address the humanity of others and where what we fundamentally do as healthcare leaders and as healthcare companies and as healthcare workers is we take people in some of their darkest moments and we help bring them back. And if we can, like for me, if I can stay focused on that end, and that's what I'm trying to do every day. Yeah, I'm trying to get a return and we're trying to get margin and absolutely we're trying to hit targets. But more than anything, we're creating extra weddings with grandma. We're creating extra Christmases and vacations and family reunions and memories and grandkids and great-grandkids and great-great-grandkids who are going to know their grandparents because of what we have done. Like if we stay focused on that end, I think the other stuff kind of falls into perspective and becomes much more manageable. And so, my counsel would be find ways to keep yourself grounded in the fundamental nature of what we do as healthcare leaders.
That is very, very inspiring, and creating more shared experiences that people will take on for the rest of their lives is impactful in a huge way. Joe, I want to thank you for taking the time to join us today. It's been a privilege to hear how Larry H. Miller Senior Health is redefining senior care while staying grounded in mission, scaling with vision, and meeting the moment for an aging population. We appreciate your insights and leadership, and we're excited to see where your team takes things next.
Awesome. Thanks, Daniel. Appreciate your time today.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.